Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. Please do not change the channel because this is must-view television here today. And the topic we're going to talk about is medical lasers. I've been in practice for 25 years as a chiropractor and an acupuncturist in Somerville. And I have been using lasers throughout the course of my practice, but I've put off putting a television show on about the lasers until now. And the reason is that there's some exciting new technology in regards to laser and light therapy. There is also great statistical data on exactly what it can do and quantifiable evidence, and we're going to go over it today. With me today is Dr. Ken Kearstan, chiropractor from Somerville. Dr. Kearstan, welcome aboard.
Thank you.
Thank you for coming and giving us a little background information today. Well, let's take it from the beginning. What's a laser?
Well, a laser is what we call phototherapy, or the use of light. And laser actually is an acronym for light amplification by stimulated emission for radiation. So basically what that means is we're dealing with light, and light in what we call a coherent manner, which means that it's a specific wavelength, and what you get to develop is laser. And what we're talking about today is cold laser or phototherapy, as opposed to hot laser or lasers that they would use in surgeries for cutting and things of that nature.
Okay. What makes the difference between those two?
Again, we're talking about wavelengths. So in technically, basically what we're doing is we're using a laser in a non-thermal manner for treatment. So we're talking about different wavelengths. Wavelengths run in what we call nanometers. This laser we're particularly talking about runs from anywhere from 500 nanometers to 1,000 nanometers, which generates this light, which creates a healing effect in tissue. So there's no heat emitted with this, or there's no danger of burning.
Okay, so no laceration or anything like that.
Correct. We're talking
now what I have here is a helium neon acupuncture laser. I've had this for approximately 6 or 7 years. What would be the difference between that and the focus of our conversation today, which is new laser technology with the MedX laser?
Okay. Well, first of all, laser actually has been used medically for approximately 35 years. It's been around for quite some time. They've done experiments with it at NASA in the 60s. And recently it's come to fruition now that they're using it in a different type of effectiveness. That laser works in a very low frequency or wavelength, which would be more focused, specific, pinpoint type of treatment. And the treatment time for that laser that they were using about 10 years ago, the treatment time is very, very long.
Right. I know that when I treat patients using the acupuncture laser, it's a long period of time because I can only treat one point at one time.
Correct. So you're talking about 40 minutes of treatment, actually.
Well, it is more involved, but there's still a significant number of patients that get a lot out of the acupuncture laser because, number one, they have an aversion to needles. Number one, they don't want to have needles. The acupuncture laser is also very good in treatment of chronic pain syndromes. It's also very good in treatment of children and children's conditions that treat well with acupuncture because the children don't want the needles. So we use it for the needle shy and basically pain-oriented syndromes. But you are correct in the fact that I do more direct needle acupuncturing than I do using the acupuncture laser. But this opens up a whole sphere of people that were had a little trepidation about using acupuncture.
Correct. So with this unit, or what they're developing now, is they're combining two types of laser type of or phototherapy. What we're going to talk about today is what we call SLDs, or superluminous electrodiodes, which are lasers you could actually look at. They're not harmful to look at, which is usually the pre-treatment, and then the actual laser, which is our coherent light therapy, which is the deepest of all penetrating therapy there is today, period. And that's the actual exciting thing we're talking about today in regards to what it can do and the effects it has on tissue. So this is actually like a two-part laser as opposed to using a pinpoint laser at maybe minute or like 40 minutes of treatment time with that, as opposed to this being about 6 to 12 minutes total.
Right.
So.
Well, I know from its cost it's a very expensive laser. In regards to the actual mechanism of the treatment, what's involved in a treatment? You know, with
okay. Well, in regards to the actual treatment, we're going to use this treatment for things that people have chronic pain syndromes, inflammatory conditions, tendinitis, things, carpal tunnel, nerve conditions. There's many treatments. The mechanism basically is the application of these two diodes on the patient's body, and then subsequently the application of this laser to finish the treatment at specific points that we're going to treat. Mm-hmm. Now, the mechanics of, or the reason why laser works, or what the actual action of the laser is that laser at this level is going to penetrate at least 5 centimeters into the skin, which is very deep as compared to ultrasound, electric stim, which only goes
diathermy,
anything
is
superficial into the skin. So what it's doing is actually working on a cellular level. So we're actually having light therapy, or coherent light, which actually penetrates the skin just like sunlight, and we're going to go into the tissue, and it's going to act on the cellular actual production and increase cellular respiration and increase action potential in a cell. What we're talking about is actually working on the mitochondria, or the very small organelles in a cell that actually produce energy. So this is accelerating the energy, or the production of ATP, which is the building block and the focus of all energy in the body: tissue repair, healing, building of tissue. As opposed to something like ultrasound or electric stim, which is great therapies, and they're still used today very frequently. The thing is that it only works on the actual inflammatory process, creating tissue respiration in and out of the tissue.
That's very interesting, because, you know, with the ultrasound, it was kind of like, which we do use a lot of it. It's kind of like a massive in with the good, out with the bad, like flushing the tissue out, using, you know, trying to revive tissue on a cellular level by bringing in nutrient and fluid exchange, in with the good, out with the bad. You're saying with this, though, it's actually the therapy is within the cell. It's on a cellular level, regenerating that whole mechanism.
This actually works in conjunction with the cell. It actually feeds the cell feeds the cell feeds off of light energy. Okay, so basically this is the only type of therapy that can penetrate in light and go all the way down to the tissue and enhance that. So we're actually talking about that we don't even need an area that has blood to it, which is a key component to therapies. In regards to what I would like to say is that ultrasound electric stim utilizes fluid in the body. It utilizes blood. This, you can treat an area that actually that is avascular. Example, a disc, a lumbar or a cervical disc actually has no blood supply in the disc itself. So what we're doing is by putting the laser or the light over that, penetrating to that tissue, it doesn't need to have a blood supply in order to accelerate the healing process. So it actually goes so deep that it's healing from inside out. And that's the exciting thing about it. It actually can help regenerate or form collagen or cartilage tissue and really accelerate that process. And at the same time, by creating light therapy into the body, just like when you run out on a sunny day, you feel better on a sunny day. There's no coincidence. The light therapy is beneficial and healthy for you. It's necessary in absorption of vitamin D. So we're heating, or not. We're not heating. We're penetrating this phototherapy all the way down to the tissues in the cellular level, and it's healing from the inside out. So that's what's so great, because it can treat things that actually were not able to be treated before.
You know, I was reading that on a gross level, this form of therapy works 40% better at healing tissues than in other form of therapy.
Accelerated, yeah.
I mean, would you say that this now is kind of at the cusp of the way in which we're going with physical
I would think so.
Therapy device?
I would think within 5 years, you're probably going to see that this is going to be a normal type of modality, just like ultrasound or electric stim is. Not replacing those things by any means. This is in conjunction with these therapies. It's just another component of it, because we're talking about areas that maybe we've had difficulty treating in the past. Carpal tunnel, post-surgical rehab in carpal tunnel, and discs. We can actually apply the laser over the spine, which we weren't allowed to or able to do in
because
ultrasound.
you're affecting different types of
Correct,
tissues in
correct.
a negative manner,
Right.
like with the ultrasound and vibrating the bone, and,
right, and deep
stuff
heating.
like that.
You don't want to heat something. See, ultrasound can be used as a deep heater too, and this is non-thermal. So we're talking about things that maybe you couldn't use before, or areas. Example: a patient with a pacemaker. You can't use electric stim on a patient with a pacemaker. You're gonna goof them up. Right?
Yeah.
So basically, this can be used on a patient with pacemaker, a defibrillator, overgrowth plates in children, across the spinal column. The only thing that we cannot use this in, or is contraindicated, would be over a pregnant woman's the stomach, over the thyroid, and directly over the eyes.
Yeah.
And even talking about in areas in here, a lot of electric stim and ultrasound can't be used in the anterior part of the neck because of the areas in here, the nerves involved here. So we can actually treat or do laser or treat this muscle in here, the sternocleidomastoid muscle, which has a lot of difficulty in regarding getting therapies in there and treating without affecting the carotid sinus in the neck.
I was reading that it's also good for treating a lot of head and facial symptoms. That they give you eye protection to wear, and then for treatment of chronic sinusitis.
Absolutely, you can put right over there. The patient is supplied with glasses. They put glasses on, and then the application of the laser is directly applied to the skin. So once it's on a person's area, you can look at it. It's just you can't look directly into the laser. So you can actually treat sinuses, headaches, suboccipital things. Just basically, that's what's exciting about it. There's very little things you can goof up with this type of treatment.
So with people that have like chronic sinusitis, I mean, this would be this would be a good option for that.
It helps. It'll help with the circulation. It'll help with the lymphatic drainage. It'll help with healing of the tissue, the irritated, even the polyps maybe in the nose would help with the swelling in there. It's just there's all types of things that can be treated with this.
I was. It's true that this is an recent FDA approval on this.
Like I said, laser's been around for approximately 35 years. But within the last 3 years, it was actually recently certified or classified by the FDA as a Class 3B medical device equipment. So, and they've done extensive studies with carpal tunnel surgery and pre and post-operative surgery, and it's a viable option for carpal tunnel. And that's what you're hearing about now. Maybe people seeing carpal tunnel treatment of carpal tunnel with laser. Yeah. But that's just one condition, and it's one of the most common conditions they've studied about that it's good for treating. And that's why maybe people have heard about this a little bit more, because it's being exposed, because many people have carpal tunnel, people have had surgery, and they're finding this is an exciting new treatment for this treatment, and to be actual, permanent in nature in regards to that, because you're actually repairing tissue.
That's awesome to mention that too, because it's one thing to go and help a person with a nerve or a musculoskeletal problem, and people would like, oh, is it ever going to come back? Sometimes we just can't guarantee that something's not going to return.
Correct.
But it's nice to have something where the premise is one that is regenerative in nature for these types of symptoms or problems. Now, in reviewing that manual, it almost seemed like they gave certain treatment criteria for given conditions. This amount of treatment, this duration for numbers of treatments. So they've got it down to, you can give a patient very specific guidelines, or?
Correct. Basically, in general, most of the treatment would consist or traverse over a 2 to 6 week period, depending on the size of the area we're treating, the sites we're treating, and the depth of the tissue we want to penetrate, and at a frequency of about 2 to 3 times per week. But the thing is that the treatment time is only approximately about 6 to 12 minutes in total. So we're talking about this being a cumulative type of treatment in manner, because at the next treatment, the last it builds upon the last treatment and upon that, and then you're actually having healing of tissue. And the patients say that they feel better when they leave after the first treatment. There's some degree of improvement already, right immediately after treatment. So things that we've had trouble with are, chronic arthritis, knee pain, things of that nature, that oscillate up and down. People are actually seeing responses after 1 or 2 treatments.
Yeah.
You know.
Well, so this would be good for people that have, chronic weaknesses or pain, and they've just tried.
Right.
They've tried this, they've tried that, they've tried so many things, and they're not seemingly.
Correct. This would make it good in the beginning of treatment, like if people have deterioration in a joint, degenerative changes, things of that nature. We can apply this therapy to actually instill a healing process, accelerate that, and get it going, and then they can continue, or will it allow the patient to exercise more, get them on their rehab protocol? Because again, this is a component of it. This is not, sounds like the magic bullet here, but basically this is
a catalyst.
It's a catalyst. It's a good word for it. It's a matter of accelerating things and really kick-starting people, because when people get in these chronic pain syndromes, the idea is to break that pain syndrome. Once that pain syndrome is broken, then
lifestyle and rehabilitation.
Exactly. Then you're incorporating all these other things.
I come across that a lot too. Is that people, that the nature of their condition is so bad that it doesn't, they can't go into an immediate active phase of rehabilitation, which really helps to strengthen around their underlying weakness.
Correct.
So this is great for chronic problems and to get them up and functioning. Was there anything like on diabetic neuropathies or anything like that? One would think, that may, if it's actually working on a mitochondrial level, that it may actually help the nerves heal in that.
Absolutely, because when people with diabetes, they have difficulty because of the balance of their sugar. They have difficulty healing quicker. So the neuropathy is a result of the diabetes or the sugar problem. So we're not looking to correct the sugar problem with the laser, but we're accelerating or helping the tissue response in regards to the nerve and the neurons and all these, stimulating C fibers and all these things.
And then, so not just for the distal neuropathy, if somebody was diabetic and had sciatica,
correct, absolutely,
or diabetic and had
you can just double the treatment time, right? When people come in, you can expect a person comes in with sciatic neuritis that is diabetic, and there's one that comes in with that's not diabetic. The healing time is almost doubled, for a person that has a diabetic is diabetic. Right. So with this, you can maybe even bring them back to maybe what we call like a normal healing type of process.
Well, that would be cost effective then, even time effective, cost effective. So it's got to be good to have this tool in the arsenal as far as what it takes to help people out.
Correct.
I rarely get excited about an instrument. I mean, we have so much. We're tripping over instruments in the office, and rarely does something come along that really makes a tremendous and a significant difference in the rate of recovery. I was even reading even open lesions can help in an open lesion situation. Not that that's the focus of the types of things that we do.
A lot of things a lot of things in treatment are actually coincidentally healed with treatment. So like say a person has we've seen people that have taken a fall, and then they have, they develop a disc problem, or they have, sciatic neuritis, and they have some bruising in the area from the trauma. With the application of the therapy, you're actually seeing the bruising go away in like 2 days or a day, actually, accelerating that process so much that the actual bruise, disappears in, double time. Sometimes people have, other skin lesions, psoriasis, rashes, things of that nature, which can be healed on a superficial level.
Would this be good for like deep muscle bruises, the kind that would get
absolutely anything deep? We're talking about deep. We're talking about the things that we couldn't get to before through conventional therapies. We can get to now because of the deep penetrating manner of it, and like I said, the working in the reverse way.
It's a distinct advantage in
absolutely.
That. You know what I was reading with too was that they use this instrument in the treatment of mouth sores, and helping to heal chronic mouth sores. And we do so much treatment using acupuncture and with the laser in treating shingles, which is a virus that lies that can be activated when at the nerve root and creates a very, very tender nerve pattern and a lesion. And I haven't been using it yet, but I'm interested to see whether we could encourage shingles to heal quicker. It just seems to be that could be
absolutely,
that could be a real money tool. The other good thing is having the treatment circumference dealing with the laser. Now this is something that both acupuncturists and chiropractors can use?
Absolutely. Basically, it's, obviously a trained professional will be using this. You can't just send this home with a patient, but there are two different ways we can use this, and we use this as a preparatory treatment sometimes in regards to either chiropractic or acupuncture. We always should use the laser first in regards to, if we wanted to treat a general area, we're talking about treatment regions and areas. If we wanted to treat like a larger area, what we would do first is apply this, the SLDs, and you put that over a general area. And this is actually non-coherent light as opposed to coherent light, which means this doesn't penetrate as deep. It kind of gets dispersed through the skin. So this would be like a superficial preparation. So you actually will feel a little bit of warmth with this. It's not hot. The patient can sense a little bit of warmth.
Just kind of like a light heat.
Right. So basically, if we're treating an area like the low back, we would start on this first, and then we would put in the appropriate amount of joules, and joules is the amount of energy that's going into it. And the nice thing about this is it's automatic. So when we press in the amount of joules that we need, the deeper the penetrating we want, the higher the amount of joules. It correlates in regards to their actual treatment time. So it's already programmed in here. If we're going to do 10 joules, it's going to be 5 minutes, or what have you. It's just going to be an actual direct lineage with the treatment time in regards to the amount of joules that we're putting in. So we'll put this on a patient, have the superficial tissue heal, get some warmth in there, and then we would come in and we would do the application of the laser, which takes about 1.5 minutes at maximum, which would be 12 joules per region. So we're talking about the patient's not laying down for a long period of time, which is another problem too.
Now this is coming in contact with the skin?
Correct. This is actually directly applied on the skin. So we would put this and we'd strap this on, on someone's hand, and then we would come in, and then that's what you need. You need contact. And we would take this, and then it would go directly onto the surface, and you just hold it. And another cool thing about this is that there's no messy gels, there's no preparation besides a clean surface area. You don't have to worry about moving like you would an ultrasound head. You can't burn a patient. You can't injure a patient with this. You can't overdose a patient. Even if you put, you're unsure of an area, maybe it's not specifically protocoled out, you can't overdose a patient with this. It's almost foolproof into it, which is great. But not everything's perfect. But it's very, very difficult to do any harm to a patient at any means. And there's no studies or no known effects or no known negative side effects to this treatment.
So let's say we take a condition like carpal tunnel syndrome. What would be a usual treatment protocol for a person coming in with that? I know that they're severe, and the thing that's good is that we can determine right when a person comes in whether that person is going to be a conservatively treatable problem with the carpal tunnel.
Correct.
Once that goes on, The treatment
for carpal tunnel would be 2 to 3 times a week for approximately 4 to 6 weeks in total.
Okay.
Depending on the condition, depending on how bad the carpal tunnel is, depending if the patient had surgery or not. And what I mean by that is a lot of times people will have surgery and they'll have a really good response to it. The direct nerve compression is taken off due to severe arthritis or severe compression through the retinaculum here in the wrist. And once that's released, it feels better.
Right.
The problem with surgery, in any surgery, there's the development of scar tissue.
Yeah.
And they've done research, carpal tunnel surgery is about 50-50. And basically people do really good with it, or they don't have any change at all. What they haven't done is they really haven't followed up with the people that have done really, really good with it, because they stop following after about 6 months. And after about 6 months, sometimes the symptoms will come back, not to the great severity that they had before, not the weakness, but they will have wrist pain again. And that's due to the collagen formation, of the irregular tissue formation of scar tissue.
So cutting the retinaculum, or that band,
correct,
is, decompressing, but the adhesions go beyond
right,
where the
So this is great for people that are post-surgical candidates. Even if people that had surgery in there, we can apply this, and you would help limit or decrease that formation of that irregular collagen tissue, that irregular scar tissue formation. So that will just even enhance the success with post-surgical responses. And doctors can, it would increase their their turnout.
Their long-term efficacy with
efficacy with the treatment.
Sounds to me as if this should be a first step, unless a person was totally dysfunctional with the carpal tunnel.
Sure.
Anyway, you know, I'm seeing more of that, and more of tennis elbow, you know, tendinitis, just people using the mouse pad all day long and doing this, just, you know, just chronic repetitive stress syndromes.
Overuse injuries, and basically what happens in overuse injuries, due to the repetitive nature, you develop adhesions, swelling, inflammation within the tendon, within the muscle. Rehab is important. Reducing that are all important components of it. Massage, ice, and you could, you know, wear bracing, and you can manage a condition and heal conditions. Sometimes the people that have to use their arms, you know, either mechanics, you know, carpenters, people that are overused, they still have to use that. So they're going to have, you know, up and downs with this. They're going to feel better for a while, and then they're going to not feel better because of the damage to the tissue. So with the application of this, we're actually helping the damaged tissue, as opposed to just creating the or helping the inflammatory process with these other therapies. You know, ice reducing the inflammation, ultrasound, those things. This can actually help repair the tissue.
With the decompression therapy that you're doing for the disc conditions in the lower back, is this something that is then, you know, a useful protocol to...
Works fantastic with it, because, you know, when decompression, we're working on compression and decompression of a disc. So we're talking about the disc, which again is avascular, which means there's no blood supply to a disc, only in the very periphery. So once a disc is, you know, ruptured, there's no healing.
Or herniation.
Herniation. If there's no blood to it, you can't heal. Okay. So what we're doing is, when we're working with decompression, the disc requires what we call imbibition, or compression decompressive forces, in order for it to remain filled with fluid and remain hydrated. That's why exercise, you feel better. That's why you feel better when you're standing with disc conditions. You're causing that compressive decompressive force. So now when we're doing traction, which has been done for years, and we're in that concept of treating that. Prior to that, we're going to use the laser to actually help heal the tissue. So we're going to use healing of the tissue, and then when we're compressing, it's like regenerating a new disc. It's beneficial in that manner, because then when you're doing the compressive forces, you're not just working on the result, what you're left. You're actually adding to that.
Sounds good to me, Dr. Kearstan. That was a very informative program. And hello, I'm Dr. James R. Golding, and for Natural Healthcare Alternatives, Dr. Kearstan, thanks for coming. This is our topic on the MedX laser. Have a great day.